In the campaigns for U.S. House and U.S. Senate this year here in Montana, one of the biggest issues on the minds of voters is health care.
Starting today, MTN Chief Political Reporter Mike Dennison takes a look at how the major candidates differ on this key issue. Today, he focuses on the U.S. House race.
Republican Congressman Greg Gianforte says his party has made progress on health care by repealing the federal mandate that individuals must buy health coverage and getting rid of other insurance regulations.
I believe we should be moving to more options for consumers, peeling back this Obamacare that's driven premiums up and benefits down. One-size-fits-all government-run health care is not going to get us to where we need to be.
Those choices include association plans, which allow businesses to pool their coverage for employees, and more use of consumer health savings accounts. He also says a proposal by some Democrats to have Medicare for all will bankrupt the country. But that's not what his Democratic challenger, Kathleen Williams, is proposing. She wants to let people 55 and older buy into Medicare coverage at no additional cost to the government.
So this wouldn't require a tax increase to cover because people would be paying their way, and it's about free choice.
She says putting more of that age group into Medicare would help stabilize the individual market for health insurance, which she agrees is much too expensive for some people. However, she opposes repealing Obamacare, saying it protects people with pre-existing health conditions and helps low- and middle-income people afford health coverage.
This piecemeal way of doing it is creating both uncertainty, and there's a projection that, tens of thousands of Montanans would lose their health care. So I very much differ with him on that. And I think we need to fix the system, not just pick it apart bone by bone.
On prescription drugs, Williams also wants to allow the federal government to negotiate directly with drug manufacturers to get prices down. Gianforte has called for more transparency in pricing but hasn't outlined any specific reforms. Libertarian Eleanor Swanson says existing programs like Medicare must be made financially sound rather than add to them. As you can see, on this issue, there are clear differences between the two major candidates. The same can be said for the U.S. Senate candidates, who we'll talk about tomorrow. Reporting from Helena, Mike Dennison, MTN News.